There's a burden for screening right now in order to examine all patients with diabetes for diabetic retinopathy and ensure that they don't have diabetic eye disease. And that's important because diabetic eye disease is a leading cause of preventable blindness in the working age population. In order to prevent it, you have to adequately diagnose it and then do timely treatment to prevent devastating eye disease. In the world today, only about 50% at best undergo diabetic retinopathy screening. And we can't scale it. What we have available today with the physicians and other healthcare workers who can screen for diabetic retinopathy, there's not enough to supply going forward in, say, 20 years. Right now we have 415 million people with diabetes. That's 8.5% of the world's population. And it's estimated in 20 years that's going to increase to 642 million people. So that's a huge burden of screening that has to be taken care of. And so some groups have approached this by saying perhaps we could do digital imaging and screen patients who for one reason or another are not getting to the ophthalmologist's office or the optometrist's office. And maybe we can screen these pictures and look for diabetic retinopathy. And these have actually been validated. They actually work just as well with proper screening programs. And more recently, groups have looked to artificial intelligence and have validated artificial intelligence as being able to grade photographs and determine whether there is diabetic retinopathy present that requires a referral to an ophthalmologist. So we too sought to use artificial intelligence, and we've applied a system known as the iArt system.